Hi, good afternoon. This is Koren from Antigua, and I'm very pleased to talk briefly about a project that we were just involved with Decides and Women Against Rape. My name is Koren Norton. I am a trained social worker and a counselor, and I work as a private consultant as well as I do social work with the hospital, and I work in the community with I work along with gender affairs department, the youth department, the police. So we do a lot of work with all the different agencies together. Some of my specialties, I do a lot of work with youth. I do a lot of work with women. I do work with civil society. I work in the healthcare system. I work with some of the organizations, doing stuff in the organizations in terms of stress management and talking to them about HIV and AIDS and that sort of thing. And this project was extremely enlightening. The amount of time we spent talking with stakeholders, it was very, very surprising how little some of them know. We spoke with professionals in the Ministry of Education, the Ministry of Legal Affairs, in the healthcare system, and in the churches, and quite a number of them do not fully understand the sociological concept of gender inequality. Some people see it playing out, but they don't see the full extent of it. So they were very happy to hear from us what actually happens on the ground. And we were able to explain to them a lot about the laws in Antigua, the Domestic Violence Act, the Child Care and Protection Act, Electronic Crimes Act. We were able to explore all the acts that were relevant to gender equality, and we were able to educate some of these stakeholders so that going forward they would have a better idea of how to help the persons. So our only job was not just to ask them questions, we were able to provide education, and that was one of the key and most important parts of this project. In terms of what we discovered, having to speak with women and men who were abused and harassed and assaulted in their domestic violence, in their domestic relationships, it was so heartbreaking. It was also enlightening. A lot of women are not empowered, and a lot of migrant women, that's like a key population, and a lot of gay persons, they participated, but some did not want us to put their story down on paper. So we have some pockets of persons who are especially vulnerable, and those are like the persons in the LGBT community, and also, like I said, migrant women. Because of their limited support and lack of finances, we find they were victimized a lot in their domestic relationships. And what we also found is that for perpetrators, there was not a lot of places to refer them to. Either they went to the prison or they went to the probation department. But we didn't find a lot of groups in the churches to help perpetrators. There is a survivors group that helped a little bit, so we didn't find a lot of that. So going forward, recommendations I would like to make: one, we do a lot of work after the fact. I would like to see more preventative work. So I would like for us to involve the young people a lot more. I would like to see social media campaigns because everybody's on Facebook, Instagram, and Twitter. So we can do some social media campaigns. We can do some drama production, art competition, poster competitions. Playing jingles on the radio doesn't work anymore because the kids don't listen to some of these radio stations. So we have to use some of the popular artists, and we have to meet the children and the young people where they are, and then we have to spend some time on access to services. We need to put out information so persons can know, if you're a victim or a perpetrator, where to go for services. But all in all, I really do want to thank the sites for that wonderful program whereby we were able to reach a lot of people in the community. Thank you.